Hi, my name is Jordan Petrie, and I will be presenting on the health and well-being of emergency providers. So, first responders, fire, EMT, paramedics, ER staff, just to name a few. A med student named Wendy created these photographs with an attached message in order to raise awareness for this often neglected group of people. I posted this on Facebook and then monitored the responses. This is the verbiage that came with the photo by Wendy. She says in her note called Code of Silence, emergency medical providers, both pre hospital responders and emergency room staff, see some of the most tragic and psychologically scarring situations in healthcare: abuse, neglect, violence, and death on a regular basis, and they rarely, if ever, talk about them. While official policies in hospital and out are to guide these providers to express themselves in healthy ways and utilize mental health resources, there is an unspoken code that pushes back strongly against utilizing such resources: the Code of Silence. But this attitude and our inability to address it is literally killing our providers. Substance abuse, PTSD, cancer, divorce, and suicide rates in these professionals soar above national averages and continue to climb. We are failing these men and women, and it's our dirty little secret. Offering them traditional crisis counseling and therapy isn't working. It's time to find a new approach. I hope this is what is expressed in my art: the frustration of a problem that continues to take the lives and health of our best and bravest, while ideas of new solutions falter and burn out. So, I work in a level 1 trauma center, emergency department, and I've seen and experienced horrific things. The majority of the time, debriefing isn't an option. If it happens to be offered, which it rarely does, there are multiple other patients waiting that need life saving treatment, so we just don't have the time to stop and do something like that. I have seen my colleagues experience traumatic stress and burnout, yet Wendy is right. No one really speaks because it's all part of our job. There have been suicides and addictions in our close family of coworkers, and nothing ever really changes. The staff grieve and then they bond together as somewhat of a dysfunctional family. Awareness is always the first step to prevention. If we can at least change the culture to foster awareness, we can meet that awareness with appropriate resources and ultimately prevent these tragic side effects that many emergency providers experience. The social media response was interesting. It was interesting that as compared to something like like the vaccine debate, no um, not even one person disagreed. Everyone expressed disappointment with current lack of prevention efforts in place for emergency pre-hospital and hospital providers. Many people liked the photo and the post. Of those that commented, the recognition of the problem became quite apparent. However, solutions were sparse. It was almost like everyone was saying, "You're right, we need to open our eyes to this problem. We need to unite and create a culture that enables and encourages speaking." But once we take this step and speak up and recognize those in need of intervention, what happens? What is the intervention? I wanted to touch on the incidence and prevalence of provider stress and burnout. These findings are based off of emergencypublichealth.net. In one meta analysis study, 10% of 20,424 rescuers experienced PTSD, with ambulance providers experiencing the highest levels of PTSD. In another study, 67% of emergency department nurses believed they did not receive adequate support following a traumatic incident. 20% considered changing jobs secondary to trauma, and 18% attended debriefings, with 0% seeking outside help for their distress. Emergency workers are at higher risk for experiencing PTSD when their efforts to save patients fail. I wanted to read this quote from emergencypublichealth.net. "I am okay. Every time emergency physicians utter these three words, they may be putting themselves at risk for developing symptoms of an overpowering, frequent secret disability, post-traumatic stress disorder." In another article, Dr. Edwin Leap states many providers do not prevent or treat PTSD from work trauma because of the thought that, quote, We get paid to expose our bodies and minds to terrible events. If it's our job and we're paid, what right do we have to be wounded? Shouldn't we just suck it up? While further research regarding evidence-based solutions to prevent provider PTSD and burnout is necessary and beneficial, there are some proven strategies that do work and prevent PTSD. One study suggests immediate debriefing following a traumatic event. Once someone recognizes signs and symptoms of PTSD, cognitive behavioral therapy can be initiated and is proven to be helpful. Regular reassessment is necessary and proven to be successful. The healthcare worker benefits when surrounded by empathetic, trusting support. So, in conclusion, awareness is essential when promoting prevention of traumatic related stress in emergency providers. The image posted on Facebook seemed to be an excellent awareness tool. The point is, social media is a valuable tool to promote prevention of PTSD in healthcare workers.